Good morning, everyone. This is Bill Miles with the Hilton Head Island Bluffton Chamber of Commerce, and welcome to today's Power Hour call. We're so glad that you're joining us once again. Since the last time that we were together, spring has arrived. We're starting to see the azaleas blooming, and then the great news is that the RBC Heritage is only about 19 days away. And we still have some tickets here at the Chamber of Commerce for sale that you can purchase. If you're interested in that, Saturday is currently, it's sold out, but there are still tickets for other days in the week, but they're going fast. We're glad our Power Hour has continued to be a trusted resource for the latest information on what's happening close to home in Washington and around the country that matters to your business. You know, we're always pleased to share with you new developments in the region and, of course, the latest information on vaccines and the pandemic. These calls are about connecting our community, and we're always pleased to have so many of you via Zoom, on social media, and also via the Beaufort County channel. The Chamber is known for connecting the business community, and we're going to do just that tomorrow night. And backed by popular demand is our monthly conversation and cocktails event. The event is already sold out, and we're excited to bring it back. And we'll be at the newly remodeled Palmyra Inn and Suites on Hilton Head Island. And Chamber Chair Susanna Cook will be hosting that again at the Palmyra Inn and Suites. And I know Kelly Brunson has a waiting list if you'd like to get on the waiting list to see if you're able to attend that event tomorrow. We also have a number of other great events, both virtual and in person, coming up. And I encourage you to check out our social media channels and our website, HiltonHeadBlufftonChamber.org, to get further engaged. I'm pleased to be part of the upcoming Back to Business Zoom call with the U.S. Chamber of Commerce for their discussion with South Carolina's newest representative, Nancy Mace. And that national call is open to our members as well as our community. It'll take place on March the 31st at 9 a.m. And we'll have call details on our social media and in our next Monday morning briefing. Encourage you, if you're not already receiving our Monday morning briefings, to simply click in the chat box below, and you'll see a link there that you can send an email to Kelly Brunson to get the latest news about what's happening in the community and also with the Chamber of Commerce. The U.S. Chamber of Commerce continues to do great things on all of our behalf, and joining us with the latest update on what's happening in D.C. makes a difference to our region is U.S. Chamber VP of Small Business, Tom Sullivan. And you've heard me say before that Tom's one of the most listened to leaders on Capitol Hill and has spent many years with the U.S. Chamber, also in the private sector, and is a past member of the White House staff under President George W. Bush, advocating for small business at the highest level. Tom has been a passionate champion for small business at the Capitol and continues to make a positive difference for each and every day on our behalf for small business across the country. Tom, great to see you again, and welcome back. I'm glad you've got your vest on, as that shows me that you're continuing to fight that battle of small business.
Thank you, Bill. It's great to be with you this morning. And I'm working out of the lower level of my house, otherwise known as the basement, but sometimes my commute is as simple as just zipping up the vest and ready to go. I'd like to touch on really just three things this morning. One is to provide just kind of a national view of how small businesses are doing based on a survey that we just released last week. Give a quick Washington, D.C. update on small business, legislative, and regulatory issues, and then finish with a little bit of an upcoming summary. So first of all, kind of from the national view, we, as you know, Bill, we run a quarterly survey with our partners at MetLife, and we just measure how small businesses are doing, how they did, how they're currently doing, and what they are viewing the future like. And like most surveys that are done by researchers and economists, there's good news and bad news. I think the overall summary is that there's light at the end of the tunnel, that light being the deployment of vaccines. And it's obvious that because this survey was in the field when vaccines started to be rolled out, it's obvious that there is a boost in small business confidence with the deployment of vaccines. Now, even though there's light at the end of the tunnel, our surveys show that it's a long tunnel. We can't seem to get past this over 50% of small businesses believing that the quote unquote return to normal is going to be longer than 6 months. It really hasn't broken below 50% for over 8 months, Bill. And so we continue to try to struggle with how do we get past that barrier. Right now, it's measuring at 59% of small businesses believe it's going to take longer than 6 months. So that is a long tunnel. But again, to emphasize the positive, it's obvious that vaccinations are providing a light at the end of that tunnel. Now, we did ask small business owners how many are going to require their employees to get vaccinated. We were kind of walking on eggshells with that. As Bill, as you probably know, it's a deeply personal decision when small business owners are faced with that decision. It was remarkable to see 52% of small businesses are going to require their employees get vaccinated. So while as kind of eye-opening a stat as that is, the actual rationale didn't surprise me at all. The rationale was because the small business employers care deeply about the health of their employees. And this is something that I know just intuitively for being a small business advocate, but sometimes it's not as obvious to some of our policy leaders in Washington, D.C. And the reason I say that is not just based on my intuition, but some other questions that we asked. I mean, when we asked employers, small businesses, kind of where their concerns are in the overall running of their business, over 70% showed that their top concern is the mental wellness of their employees. So it actually kind of goes hand in hand with how small businesses treat their employees, how they care about their employees. And so that is certainly an interesting finding in our quarterly index. Now, as far as a Washington, D.C. update, so the head of SBA was confirmed by the U.S. Senate last week, Isabel Guzman. And the PPP deadline is 1 week from today. Many banks have stopped accepting PPP applications, and that is because it takes sometimes as long as a week to get these applications through. Bill, I suspect you've heard from some of your members some of the struggles that they've had in this second round of PPP. Mostly it has to do with some of the authentication and fraud prevention controls that the Inspector General at SBA insisted be built into this new loan portal system. So if you don't have a PPP yet, and a banker or a loan officer says, I'm sorry, we can't help you, that's the reason. Now, we are pushing as Congress to extend this by 2 months, but I've said it over and over again. You never want to base your business decisions on what Congress may or may not do. It would be a really bad move. But we are pushing Congress to extend the PPP deadline for 2 months. It's basically a 2-month extension and then 1 month for SBA to kind of clean up a lot of the challenges that small business owners have faced trying to get through this fraud prevention loan portal that has experienced a number of glitches, just like a lot of software updates cause glitches for all of us in our own personal undertakings. Another update is the Shuttered Venue Operator Grants, a long-awaited grant that can provide up to 45% of a business's past revenue, annual revenue. SBA has announced that grant program will open up on April 8th. And Bill, I suspect you've already covered this because you're such in contact with your membership. But just as a reminder, you need two things before you apply for the SBA Shuttered Venue Operator Grant. First, a DUNS number. That stands for Dun and Bradstreet. It's free to get a DUNS number, but you are required to have a DUNS number. And the reason you're required to have a DUNS number is because every applicant must register with the federal government's grant portal. And that's SAM, S-A-M, sam.gov. You have to register. Now, getting the DUNS number and registering with sam.gov can take a few days. So it's in everyone's best interest to get the DUNS number, register on sam.gov in order to get ready to apply for the Shuttered Venue Operator Grant. Now, if you're a restaurant, the Restaurant Revitalization Fund, there's been no announcement on when that's going to open up, but the same two requirements exist. So if you're a restaurant and you're counting on applying for the grants that were part of the American Rescue Plan that was recently signed into law, you also should go through the process of getting a DUNS number and getting registered on sam.gov. Last but not least, just want to reiterate that you've got a little bit longer to talk with your CPA or accountant or tax preparer to figure out all of the machinations that go into your annual tax filing. You've got a little bit more time. You've got until May 17th. So the IRS pushed the tax filing deadline to May 17th. And then South Carolina's Revenue Department also extended the tax filing. But make sure you know that does not give you an extension on the April 15th quarterly estimated tax payments. So we learn from the past, right, Bill? And last year, this is something that a lot of us made a mistake in the small business arena. We thought we saw that IRS was going to push the tax filing deadline off, and we naively thought, oh, well, maybe we can put some more money in the bank and earn interest. But no. You still have to pay the April 15th quarterly estimated tax. But the actual tax paperwork, where we do need some extra time to figure out all of the tax advantages that have been built in to various stimulus bills, to get that information to the IRS. So you do have an extra month to get the paperwork done. So with that, I'll stop. Happy to answer any questions, Bill, and thank you for having me on.
Tom, thanks for another informative update. Several questions for you coming to us this morning. The first one is coming from Donna, and Donna is asking what type of benefits can be expected from the Restaurant Revitalization Fund?
So the Restaurant Revitalization Fund is actually a grant program for restaurants that have experienced a diminution of revenue year over year. This was something that the National Restaurant Association was very aggressively pushed. The U.S. Chamber of Commerce joined with the National Restaurant Association. Took about a year to get into law. It will be operated by the Small Business Administration. And in the weeks ahead, all of the answers that, all of the questions that Donna probably has kind of going in her mind will be answered by SBA and Treasury in the rollout. All we know now is that the fund exists. We are hoping that it open up soon, but we do know that SBA is scrambling to try to get frequently asked questions done, completed, and out to restaurant owners and stakeholders like Donna, so that their questions are answered before the actual applications are open. And this is a program that I'm actually fairly optimistic will open up sooner rather than later. And the reason I say that is because Chuck Schumer from New York is the Senate Majority Leader. There are very few states who have more restaurants who are struggling than New York and New York City. And so he has a vested interest and making sure that SBA gets this up running as quickly as possible. And he has certainly expressed that privately and publicly. So I'm fairly optimistic that it'll be up and running soon, and that many of the questions that Donna and others have will be released by SBA ahead of that application deadline. And Bill, you'll be the third person to get that information as soon as it's released.
Thank you. Thank you for that, Tom. Also want to mention the survey that Tom mentioned earlier is posted in our chat box. There's a link there, so you can link on that and see the survey and the results that he was referring to. Tom, next question is coming to us this morning from Rick. And Rick is asking, if a venue is both a restaurant and entertainment venue, are they qualified to apply for both the restaurant grant and the event venue grant?
Bill, that is a great question. So on the shuttered venue operator grants, the business primarily has to gain its revenue from ticket sales related to the live performance. So that kind of narrows in very quickly what the shuttered venue grants can give. The restaurant revitalization fund grants are ones that are more obviously for the restaurants. And honestly, I think the answer is no, you can't apply for both, but I don't know for sure, and I will get back to you. I do know that restaurants that have live entertainment don't qualify for shuttered live venues. Those are you have to have ticket sales based on a live performance in order to qualify. Obviously, some serve food, but aren't primarily restaurants. And I'll make sure to get back to you on whether or not you can apply for both.
All right, thank you for that. Then once we hear from Tom, Rick will get that back to you. Next question is coming from Jennifer, and Jennifer's asking if you feel that the tax filing deadline will remain on the May 17th date, or is there a chance it might be extended?
Oh, that's a great question. I expect that the tax filing date will stay the same. The question probably comes from the fact that last year it was extended all the way through July. So I expect that it will not be extended past May. And then obviously there are a number of ways that you can be granted an extension, and certainly work with your CPAs, tax preparers, and accountants if you do need extra time. Bill, I had thought that after the pandemic and when everyone's vaccinated, we should have a Hug Your Banker Day because of the remarkable work that bankers have done to get capital to small businesses. I think possibly it should also be a Hug Your Banker and Your CPA Day, because the spider web of tax advantages that are intended to help are really, really complicated. And so not only is that a good question based on last year's extension to July, it's also a good question because it's really, really complicated if you really want to get the most out of all of the tax credits and incentives that have been built into three massive stimulus: CARES Act, Economic Aid Act, passed right after Christmas, and then most recently, the American Rescue Plan.
Tom, thank you for that. And we're going to take your idea. We love it. And we're going to take that and run with it on Hug Your CPA and Hug Your Banker Day. It's a great idea. It's well deserved. You mentioned vaccine just a minute ago, and Ray is asking if you believe there will be a national vaccination ID or passport available and accepted by businesses.
It's interesting. So the simple answer is I don't know. I think we've got to keep our eyes close on the air travel industry to get the real answer to that, because domestically in the United States, there are when you get vaccinated, there are records, mostly to make sure that you don't get 3, 7, 12 shots if you have problems with your memory or other. But there's certainly a tracking domestically of vaccinations. And I think the challenges really are amplified when you're in a situation that is hosting international visitors. And certainly Hilton Head is no stranger to this. I mean, folks come from all over the world to enjoy the Hilton Head Island. And so I would keep a close eye on the air travel to answer that question, but no indication now. I do want to emphasize something, though, on vaccines, and it has to do with taxes, because this is part of the American Rescue Plan. Employers are able to provide time off for their employees and get reimbursed for that time off if they do that voluntarily through tax credits. So not only are employers able to do that, but self-employed are able to take time off themselves to get vaccinated and then apply the tax credit to their filing of quarterly payroll. So it gets complicated about which portion of payroll you're taking the tax credit from. So please check with your bookkeeper or your payroll provider or your CPA. But I do want to note that this is something that is an additional tax advantage to those employers who want to do something to encourage their employees to get vaccinated, or really just need some help financially to cover those lost hours that either they themselves are bearing or their employees are bearing.
Thank you, Tom. I want to share with you just a little bit of information. We recently did a survey, and what our businesses are showing locally is that they are optimistic. About 90% of those saying that they are optimistic or are somewhat confident to very confident about the future of their business. So we were pleased with that. And then another 59% believe that their gross revenues will increase over the next 12 months. So just wanted to share that, and we were pleased with the way those numbers came back. One more question for you, and before we let you run, and this final question is coming from Carolyn, and Carolyn is asking if you believe there will be another wave of relief, or if whether that will be necessary with the economic resurgence that we're starting to see.
So, Carolyn, I don't think that there's going to be another stimulus, and here's why. There are a number of programs that haven't actually even been started. The Restaurant Revitalization Fund is actually a very good example. And I think that there is a certain amount of impatience amongst the lawmakers to see what is working before then putting more money into additional programs and additional funding. And that's what leads me to believe that the answer is no. And while I am generally involved on the federal level, there are a lot of money coming through states intended to help small businesses that also have not been stood up yet. And I believe there's more and more of an anxiousness amongst federal lawmakers to see how those programs are working before diving into another stimulus. So a little bit longer of an answer than just simply saying, no, I don't think there'll be another stimulus. But generally, I like to try to flush out the way that I'm coming to that conclusion.
Tom, thank you. You're always a wealth of information, and we're always pleased that you take time out of your busy schedule to share with our members and community information on small business.
Thank you, Bill. It's great to be with you.
Thank you. And again, that was U.S. Chamber of Commerce Vice President of Small Business, Tom Sullivan. Tom talked a little bit about venue shutters and event spaces, and that's going to lead us into our next topic. We know that our region has an impressive sports and entertainment project under construction that we will be able to enjoy starting next year. We're excited to hear from our next guest about one of the city of Savannah's largest capital project investments in their history, and that's the new Savannah Arena, now under construction. All of us will undoubtedly enjoy concerts and sporting events in the new 9,000-seat arena, as well as the surrounding Canal District that's going to also be an attraction. Here to tell us more about that is Monty Jones Jr. of the Oakview Group. Monty brings over 20 years of venue management experience to his current role as the general manager of the Savannah Civic Center and new Savannah Arena. Monty is here to tell us all about this impressive investment in our region. Monty, welcome to the call, and thank you for joining us this morning.
Hey, Bill and Chambers, thank you for having me. As Bill stated, yes, I'm Monty. I'm here with Oakview Group, and I'm going to share a screen with you to kind of go over a small presentation for you. Let's see. And let me get thumbs up just to make sure everyone is able to see.
We have it.
Okay. All right. So with the new Savannah Arena, we are going to be the unraveling of the new entertainment destination for the Southeast. With that, with our leadership together with these three guys, Tim Lewicki, Irvin Azoff, and Peter Luco, bring well over 120 years of experience. We're looking at Tim Lewicki. He was the former CEO of AEG Corporation, which shows the likes of those who may know of the Staples Center, the LA Kings, the LA Lakers, the LA Live, but then also the big music festival that we call Coachella. That's all of Tim's, world expertise, and his leadership was bringing all of those together. But then you look at another part of our leadership, Irvin Azoff. Irvin Azoff is probably the biggest music mogul manager in the world. Has the likes of the Eagles, Fleetwood Mac, Madonna, Bon Jovi, Journey, Harry Styles, Travis Scott, just to name a few. But then also, formerly he was the CEO of Ticketmaster and chairman of Live Nation when that merger was together. And then also with MSG Entertainment when they took over the Forum that's in LA. So we're bringing those two together on that level. There's nothing but great things to come from this company. And then you add the likes of Peter Luco, who's the co-chairman of Oakview Group, and he's over our facilities in. Peter Luco started Global Spectrum, which is now known as Spectra, which ran over 120 venues. But then also the likes of those who may know of a basketball player by the name of Allen Iverson. This was the man who drafted Allen Iverson for the Philadelphia 76ers when the company that he ran owned the 76ers and the Philadelphia Flyers with Spectra. So with looking at those gentlemen there, with our company as a whole, we're able, and we're currently right now having $4.5 billion worth of just development projects. That makes us the largest in the world right now for live entertainment facilities. And kind of looking at those facilities as we are talking about right here with Savannah, we are truly invested in Savannah in this region with us putting in funding to be a part of this project. But then also one of our bigger undertakings is also Climate Pledge Arena that's in Seattle, where we also were able to garner an expansion team for the NHL. And it's the expansion of the Key Arena where the Seattle Supersonics and so forth used to play. Additionally, we have the New York Islanders where we're building the USB Arena on Belmont Estates. And that's Belmont Estates where the racetrack is. So we're building this arena along with commercial and residential space that's going to be out there. Then we partner with some guy, I think he was the best looking guy in the world a couple of years back, Matthew McConaughey. He's our partner at the University of Texas where we're opening the Moody Center. We're building that from the ground up as well. And then as I talked about Coachella, where the Santagila Arena, the Coachella Valley Arena that we're building out there in the Coachella Valley. That's a new arena where they don't have an actual arena, where they're mostly been looking at festival-wise. And then as we talk of Irvin Azoff with his relationship and being a manager for Harry Styles, we have Co-op Live that's over in Manchester. Co-op Live is actually a grocery store chain that Harry Styles used to actually work as a kid. So that was a great merger with those two to be able to name the rights. And then the Santagila that will be in Milan, Italy, that will be part of the 2026 Olympics. And so looking at our company as a whole, we're not just looking at the managed arenas, but we also have our Arena Alliance. Our Arena Alliance are consisting of 29 venues. Of those 29 venues, 22 of them are in the top 25 DMA markets in the US, where we have 17 of them have NBA facilities, and then 17 have NHL. Looking at our region, the closer to our regions are looking at the State Farm Arena that's in Atlanta. You look at the Spectrum Center in Charlotte, and then also you look at the Amalie Arena in Tampa. So those are the closest within our region with having that. And as you see kind of the wide scope and the worldly scope that we look at for our company, you would think, why Savannah? Why would this company look to invest part of that $4.5 billion in Savannah? Well, it just comes with just this region of the Southeast, with the Carolinas, Georgia, and Florida, where looking at, as Bill was talking about, the Canal District. With the Canal District, we're looking to build and having nature to grow and cultivate within this area. But then we're also looking at the heritage of the west of the historic district that has not really received this much love. So with building the new arena out there, it gives us the opportunity to, build on those strengths, to show people, the culture or heritage that's out there, to also provide growth, as you see currently in Savannah, where they're growing both in the east of downtown with the Eastern Wharf, but then we're also growing west as well, where we're looking at the Canal District. But then also there's a focus on economic development, diversity, inclusion, and environmental sustainability. Once this building is built, we will be Silver LEED certified for this venue. But then also, as part of this project, the city wanted to, with building of this construction of this facility, they wanted to have a local and a regional tie with employment. And so they championed with the contractor AECOM Hunt to provide a minimum of 20% to be local, minority, and diverse business to be involved with the construction of this. And then they also transition over to the management with our company as they send out RFP for that, where we were actually up to 25% as far as for revenues that would come from this building. Currently within the build out of the construction, we're currently sitting at 26% are local diversity, women-owned businesses that are part of the current project of the revenue operating expenses. Looking at the management portion that I will oversee, we went to exceed that portion, and we are looking at 75% of our event operating expenses will go to local Savannah diversity women business owned local businesses for this region. So that was a huge thing of what we're looking at, and looking to have economic growth and to sustain the local and the area region. As you look at the scope, as most of you know, when you want to go to a show, you're probably in the Hilton Head area. You're probably driving north to North Charleston, south to Jacksonville, or heading, west over to Atlanta to see some great shows. Well, we want to be able to stop that. We want you to just come just across the state line, a little 45-minute drive to come over here to Savannah to enjoy the great things that we're going to have. So real quick, I hope that everyone kind of has on their dancing shoes, because I want to show you a quick video. Are you seeing the video?
Just a little bit of a delay. We have not seen it yet, Monty.
Okay, let me switch the screen. All right. Has the new screen popped over now, Bill?
Yes.
Okay.
Here we go.
All right. So, as if that doesn't get you hype about this new thing, we're going to be the point where music and sports meet, where we're going to treat music as a tenant like most places treat sports. As you are probably aware, we've garnered a ECHL hockey team. So the first professional hockey team to the region that we're going to have. So we're going to have the likes of competing with North Charleston so that we can beat them every time that we play them, and also Jacksonville, both north and south of us. So, that's going to be a huge for us here with having that ECHL hockey team. But then also looking at it, we're looking to have roughly over 150 nights of all entertainment, where we're looking at hockey and sports and so forth, whether it be, hockey or basketball or indoor soccer. But then also looking at averaging roughly, 2 or 3 or so concerts a month that we plan to average. But then also, we're not going to forget about local, community, and regional events. So that's still going to be a part of what we look to garner, whether it's graduations or different music festivals or heritage festivals and so forth. We're still going to look to garner those events. And then as we kind of go into the venue as a whole, you look at, there's not going to be a nosebleed in this arena. The way that the team built it is going to be great seats all the way around. As you see, we have different, and this is also a new way we're going to be doing business here in Savannah, is that, these areas here, we're going to have club seats. We're going to have a suite level that's in the black area here, but then we're going to also have lounge seats. And these are areas where you can conduct business, you can entertain clients, entertain employees, and so forth. So we're looking at being there so that you can have different ways of doing things and coming to enjoy, great things here. There's going to be, as I stated, the Upscale Hospitality. As we talked about the events and the concerts and the food, we're going to look to garner a Savannah and coastal flavor to the food that we provide in this place and bring that culinary experience from outside of our region into this venue. And then looking at our timeline, as we broke ground in September of 18, currently right now, we're roughly in between this, where we announced a hockey team, and we're going to be announcing some concerts and so forth soon, probably towards the end of the spring, first of the summer. And, once you guys kind of hear these concerts that we're going to be announcing for the first couple of months of opening, you're going to be like, man, this is happening in our area. So, that's going to be great so that you won't have to travel. You can save that time for you to just come local, and you'll be able to sleep in your bed instead of having to travel, and stay at a hotel. Well, we'll get people to travel with us already being destinations. We'll get them to travel to our region and spend the nights in our hotels and motels so that we can do that. And along with essential completion, we're expecting to have the venue complete in December, go through the punch list of this year, and hopefully be ready to open in January, February of 2022. And as stated, this is a new way of entertainment in the Southeast, and we're just looking for a positive way to conduct business here in Savannah now. That's the end of this presentation.
Monty, thank you so much. First of all, congratulations on the vision that your company has for this project and the amount of economic development, the capital that you're going to bring to the region. Thank you for that. We've had several messages just saying what an exciting project that I'll share with you. And then one question's coming to us from Marilyn, and Marilyn is asking, we often think of concerts in Charlotte and other larger areas. Will we be able to see the same type of concerts in the new arena?
And the answer to that is yes. As I stated about our Arena Alliance, that is a huge play for us, because with Savannah, we kind of align within the Charlotte, the Atlanta, and the Florida venues that we have. So we're able to make an easy transition, because with these concerts and these bigger artists, is all about, fitting within the routing. And with having those as part of our alliance, that, we're on a monthly call and talking about all the different, major artists that are going out, we're part of those conversations. But the plus with that is Live Nation. Live Nation is the biggest entertainment promoter in the world. Live Nation, back in pre-COVID, they were responsible for 88% of live entertainment concerts. And they are our partner here at this venue. And so with having that along with the alliance, that only bodes for great things and great events to come here to Savannah.
Monty, thank you. We have posted the link to your video if people want to go back and watch that or share that with others to see that video again. Impressive video, impressive project. And we look forward to having you back on sometime in the near future for an update and then to talk some more specifics of it. But thank you so much for your time today and for joining us.
Hey, thank you all for having me.
All right. Thank you. That was Monty Jones Jr. and to give us an update there on the new Savannah Arena. Our next speaker is a guy that fortunately has been with us for a number of calls, providing great information, and here to share a little bit about some of the new developments in vaccine deployment is Jeremy Clark, Market CEO for Hilton Head Regional Healthcare. Jeremy, thank you for your leadership and welcome back to the call.
Good morning, Bill. How are you today?
Doing great, thank you. Good to see you.
Great. It's good to see you. It's great to be back on this call today. We have a lot of very positive things going on in the community. We just heard about one of them, and hopefully I'll be able to share some more of them with you. To get started this morning, give everyone an overview of what we are seeing. Today, for the first time in over a year, Hilton Head Hospital in Coastal Carolina have a total of 0 COVID positive patients in-house with us today. Really an incredible, remarkable number, especially when you think back over the past year and everything that's been accomplished since then. As you think back a year ago, you think back with our health system, we started with securing enough personal protective equipment to make sure that we could keep our patients, our colleagues, and our physicians safe. We then started developing plans to add beds, to add ventilators, to cross-train staff to do other functions. And fortunately, those plans were not needed. But we did provide high quality care through multiple COVID surges, both providing care to COVID patients, but as often said on this call, to the vast majority of patients in our hospitals who did not have COVID as well. I think back to partnering with the community to offer those mass testing events in the summer, and then transitioning that effective September 1st to offering daily COVID testing for 4 hours each weekday at 2 different locations in the community, Hilton Head Hospital and Coastal Carolina Hospital, offering it to patients at no cost and without a physician order. We did that for 6 months. And it's truly been an incredible journey. It would absolutely not have been possible without the awesome colleagues and physicians that we have, but also without the incredible support that we've received from this community. I think back from those in the community who made the cloth mask for us really early on in this situation, to those individuals and restaurants who brought food for our colleagues in the departments, to just anyone who sent the kind notes and the words of support. It was so appreciative. It really helped inspire my team as we went in and as we did this every day. So I just want to say thank you to everyone in the community for all that's been done. And I'm just really glad to be presenting on this call today as reporting that we have 0 COVID positive patients in-house. But we all know it's not over yet. COVID is still around, and we need to remain vigilant. But we are transitioning to the vaccination phase. And so I'm going to give everyone an update on vaccinations here in our community. So to date, our 2 hospitals have given around 25,000 doses of vaccine. It's been great to partner with various groups in the community, from Beaufort County School District, Jasper County School District, many private schools, local churches, volunteers in medicine, even the Fusky Island Fire Station. We did an event there last week. So we're excited to ramp that up even further, and really excited and appreciative of DHEC's efforts as we start to see vaccine availability starting to increase as well. So some exciting developments on that front. But really exciting for us, starting today, we are offering vaccinations at the Buckwalter Recreation Center at 905 Buckwalter Parkway. And we're doing this so that we can offer many more vaccines each week and really vaccinate more people more quickly and help our community get through this disease more expeditiously. You know, to put it in perspective, last week we administered a couple thousand vaccines. This week we'll do a little bit more than 3,000, and next week it should be close to 4,000. So not only are we able to vaccinate more people, it should also be a much better experience for those being vaccinated, much larger space, hopefully much more efficient throughput as well. For anyone who had an appointment that was scheduled at Hilton Head Hospital or Coastal Carolina Hospital, they should have received an email notifying them of this change. For most people, the appointment date and the appointment time will be the same. Only the location will change. So overall, we're very excited about this change and very appreciative of Beaufort County for offering us this great space at no cost. And we're incredibly appreciative of the hundreds of people in our community who have volunteered to help out and help us give vaccines. Truly shows what a special place this community is. I'll also say that we have appointments available. We have appointments available today and tomorrow, and there are some out there right now. I went and checked before this call. So if you are registered in VAMS already and you're interested in getting an appointment this week, you can go into the VAMS system and make an appointment with us today and tomorrow because there are some available. If you're not in the CDC VAMS system yet, but you are either 55 or older, or you're a member of one of the phase 1B designated groups and are eligible for the vaccine, and you want to get an appointment, here's what you need to do. You can start off by going to our website at hiltonheadregional.com, clicking on the vaccine information link. There'll be a form that you'll complete that'll ask you for your name and your email address and some other information. You'll hit submit. I will note that it needs to be a unique email address. It's got to be an email address that is specific to you. It cannot be one that someone else has used to get a vaccine. It cannot be one that is already in the CDC VAMS system. So that'll start the process. Within 24 to 48 hours, you'll receive an email from the CDC with a link on it. You'll go in via that link and complete a little bit more information, and you'll be able to schedule an appointment. You'll be able to look around the community and schedule an appointment that way. We will be adding appointments each week. So I want everyone to be aware of that. We try to post it on social media as we add them to generate interest and make everyone aware that those vaccines are available. There are other ways to get appointments. I'll ask everyone to continue to be aware of other providers that are coming online and opening up sites. They are opening up appointments, and you may be able to get one sooner with them than you can with one of the local hospitals. And I'll really say the sooner that you can get an appointment with any type of vaccine, whether it's Pfizer, Moderna, the Johnson & Johnson vaccine, I would say do it. The sooner the better, regardless of the type of vaccine. The key is really just getting us all vaccinated. So, Bill, I'll wrap up on this very exciting day. I want you to know that our hospitals remain ready. We've created a safe environment to provide care. We will continue to provide care to COVID-positive patients when they present to us, but we're also providing care to the vast majority, and today, all of the patients who are with us who do not have COVID. We appreciate the leadership from our state and local officials who have helped us all get through this, and really appreciate everyone's support. This community has been fantastic from the beginning on this, and really just appreciate everyone's support as we go through it. So, Bill, I'll go back to you for any questions.
All right, Jeremy, thank you. The first question that we have is, if you got your first shot in Charleston, can you get your second one here in Bluffton?
Great question. You really need to stay with your first dose provider. And that has to do with the way that hospitals and vaccine providers are allocated their second dose. We will get enough vaccine to vaccinate everyone that we gave a first dose to, but we are generally not given enough vaccine to vaccinate everyone that we gave a first dose to and new people. So it really helps if you are able to go back to your original provider for your second dose.
Jeremy, I know you've got another call. Just a couple more quick questions for you quickly. One is coming from Lily. Lily is saying that Safe Harbor has clients without emails and can't register on any sites. How can they get their elderly appointments?
Okay, I would say work closely with DHEC. I think Dr. Kelly may be on this call after me this morning. She may have an idea. I know some of the local health departments are working with many individuals in that situation to help get them registered. And so DHEC may have some advice and guidance on that.
All right. The last question for you, Jeremy, is from Karen. And Karen is asking, I already have my appointment scheduled for June, but have heard of new openings sooner. How do I reschedule my appointment to get an earlier date?
If you have an appointment that's already scheduled in VAMS for June, you can go into the VAMS system and then cancel that appointment and rebook one that is open today or tomorrow. That is the way that you would do that. I'll tell you, we'll also be opening up appointments in the coming weeks, and so you should be able to be vaccinated before June.
Jeremy, thank you. And I got just chills down my spine when you said 0 COVID positive cases in both of your hospitals right now. That's such good news. And thank you again to you and your entire team. And we'll continue to push through on this pandemic.
Great. Thank you, Bill. Thanks for having this call. This continues to be a great resource for our community as it has been for the last 12 months. So thank you for doing this.
You're welcome. Thank you very much. Again, that was Jeremy Clark. And Jeremy is the market CEO for Hilton Head Regional Healthcare. We're going to continue that healthcare component of our discussion, and our next guest deserves a thank you, just like Jeremy does and all of the teams. Week in and week out, she's been one of the voices of knowledge and calm as we navigate through COVID, and that's our friend, Dr. Jane Kelly with DHEC. Dr. Kelly, thank you for joining us this morning.
Oh, well, thank you for inviting me. I just learned something new about the tax credit for time off after vaccine. That's very helpful information. So let me share my screen. And I'm going to give you an update on a couple of different things today. First and most important, I do want to offer the information that Krispy Kreme is offering a free donut a day for showing your COVID-19 vaccine card. So just want to make sure I shared that information. Our 7-day moving average of reported new COVID-19 cases, I'm showing it here by public health region, but obviously it's for the state as a whole, continues to come down, which is terrific. But you'll notice it's a little bit plateauing. Oops, sorry, I didn't mean to move forward. A little bit plateauing at the end, and we remain concerned that Passover, Easter, holidays, family get-togethers, spring break, that we may start to see another surge after those holidays. So, keeping fingers crossed is not enough. The rates are coming down for a combination of reasons, including vaccination, but they're still coming down also because people are paying attention to those elements of masking and keeping distances. So we've come this far. I hope people can, continue for a little bit longer until we have enough people who are vaccinated that we can achieve some element of herd immunity. I will talk a little bit about that at the very end. I'm not quite sure why I'm getting Lisa Haddad lines across my screen, but I'm not controlling that. This slide shows a rate of new cases per 100,000 by county in South Carolina. And if this is available on our DHEC website, if you go there and hover over the county of interest, you can get the specific numbers. So for example, I just did this morning. This is for Beaufort County. Incident rate has come down considerably. It had been over 200 per 100,000. So it is now at 105 per 100,000. That's great. That reflects residents mostly, though, and as we get into warmer weather, we may remember that we'll have an influx of tourists. So we're still considering this moderate incidence, still reason to keep those mitigation measures up. This is from our DHEC vaccine allocation webpage. We have received over 2.3 million doses of vaccine. Remember, Pfizer and Moderna need 2 doses, so that doesn't directly translate into vaccination adequate for over 2 million people. But just so that you can see the number of doses that have been given, Pfizer, Moderna, and we now have on this allocation page the Janssen vaccines as well. Our initial shipment of a little more than 40,000 doses of Janssen vaccine went out to mom and pop independent pharmacies throughout the states and to some of the federally qualified health centers. We've recently received additional doses, which will go to replete those supplies in those settings. As we get more vaccine, we'll be able to make it available at other settings, and people will have more choices about which vaccine they are able to receive. But just to echo what was already said, what's the best vaccine? The best vaccine is the one you can get soonest. All of these vaccines are excellent in preventing severe disease and death, and that's the goal here. We also have a vaccine dashboard, and the vaccine dashboard shows the recipient. This is the recipient view. How many people have been vaccinated? How's our progress towards that goal of getting people completely vaccinated? And it also includes a lot of other information that you can search for. For example, you can look at specifically by county where South Carolina vaccine recipients live. This is different. In our first effort at the dashboard, we had a map, and the map showed where vaccines had been given. So it didn't necessarily mean that where people lived who got vaccine, it was where it was being, where they were being vaccinated. There are lots of other details on this dashboard. I'm just going to point out a couple of others. The fact that you can look up vaccine recipients by age, sex, and race. And you can also drill down to look at the zip code level to see where South Carolina vaccine recipients live. So there are lots of different ways that you can select information. I'm just showing you a couple of features. One way to register for an appointment for vaccine is through this vaccine locator or through the VAMS system. But we know that this has created a lot of complications, a lot of challenges for people using this system. I want to talk about an alternative system. There's an alternate system to using the Vax Locator to find appointments. We're piloting it. Right now, it is only at DHEC clinics. We hope to open this up further, but right now, it's only at DHEC clinics. But its big advantage is it indicates at a glance which DHEC clinics have appointments available. So I just took a few screenshots. And I did this morning. So this is right now. You go to the CVAS. The link is there on the bottom, but if you just Google CVAS DHEC, it'll bring you to this site where it will say, okay, here's when I accept the privacy policy. I'm going to click on Get Started. And there's a drop-down box that will list all the different DHEC facilities at which there are appointments available. So fortunately, you don't have to click through all that eligibility stuff only to find out vaccines not available. It tells you up front where places are available. Click Get Started. It's going to take you to a number of different screening questions. I didn't include all of them here. I'm just going to show you a few. For example, it's asking you 1B eligibility questions. Are you age 55 or older? And if you click yes, for example, it'll take you next to, is this your first or second dose? And you would, click appropriately. And then it'll take you through a number of other questions. Have you had COVID before? Are you pregnant? Have you had monoclonal antibodies? Have you ever had a severe allergic reaction? That sort of thing. Then if you are, after you answer those questions, it will take you to a screen where it has all the available places where there is vaccine currently available, and you can select your location. So for example, I selected Beaufort Health Department, and it gives me a choice of selecting a day. I selected Saturday, March 27th. And it gave me 1:30 p.m. Now, maybe this particular appointment is already gone, but just to show how easy it is to click through things. What if I had clicked, no, I'm not 55 or older? Then it would ask some other screening questions like, are you at increased risk because of a medical condition? Yes, no. And it would ask, are you a frontline worker with increased occupational risk? Yes, no. And if you said no to all three of those things, then it would say you're not currently eligible to receive COVID-19 vaccine. You're in phase 1C or phase 2, so consult with your physician for options. So this is a great improvement. As I said, it is right now only available at DHEC sites, but we hope to make that available more broadly. I want to comment on some of the school distancing recommendations that have come out of CDC. We've all seen headlines like this. CDC changes school guidance, allowing desks to be closer. Students can sit as close as 3 feet to each other in the classrooms. I want to add a bit of caution to this. Here's specifically what CDC says. Their recommendations reflect that 3 feet between students in classrooms is okay, but that they want to provide clearer guidance when a greater distance, such as 6 feet, is recommended. And it's complicated. They've got a lot of different recommendations having to do with whether you're talking elementary school, middle, or high school, whether you're in a community transmission level that is either low, moderate, substantial, or high, having to do with percent positivity as well as incidence. The bottom line, what we're recommending in South Carolina is we're continuing with our recommendation that distancing 6 feet, if possible. I mean, and understanding that in some facilities, some school facilities, that's not going to be possible. Literally, what we say is to keep the 6 foot distance, quote, to the extent possible. One of the issues is that if you've got students who are just 3 feet apart, but one of them becomes positive for COVID-19, then that student who's only sitting 3 feet away is considered a close contact and would still be expected to quarantine. So we're not making radical changes just yet in terms of our school situations, in terms of our recommendations. We'll continue to work with individual school districts to try and understand these guidelines and apply them to their individual setting. I've been doing a number of presentations with a variety of different groups, and I got this question yesterday. What's the point in getting vaccine if I could wear my mask, socially distance, et cetera, anyway? Just want to reiterate, wearing a mask, et cetera, is not forever. Once most people are vaccinated and the number of new cases goes low enough, we can unmask. Last week, I spoke in a very hurried fashion, but I presented on what you can do if you are fully vaccinated. And just to reiterate, fully vaccinated means 2 weeks after your second dose, if it's Pfizer or Moderna, or 2 weeks after your Janssen dose, you are considered fully vaccinated. It is okay to get together with other people who are fully vaccinated. We're talking in a private setting, not in a big, indoor setting. You're trying to limit your exposure to other people and limit the number of people you expose yourself to. But the two big social advantages is that if you're fully vaccinated, you can get together with other people who are fully vaccinated or with people who are unvaccinated but at low risk. I think of this as the grandparents getting together with the grandkids scenario. And the other big feature is you don't need to quarantine if you're exposed to SARS-CoV-2. But let me go back a bit to the when can we stop with this? When do we achieve herd immunity? And I know that the modeling experts have shared various numbers, percentages. Oh, we need 70%, we need 80% of people immunized. I'd like to point out that this is not an on-off light switch. It's more like a dimmer switch. It's like the fewer cases we have, then the fewer people who are exposed, and so the fewer people are going to transmit. So there's no magic cutoff number. What we're going to have to do is watch what's happening in our community. So in this graphic, no herd immunity on the left, one infected person in red, they spread it to, in this graphic, 4 other people who then spread it further to 2 more people each. And you can just see how that multiplies. Whereas in the herd immunity one, we still have some people getting infections. This is not 100% coverage, but they spread it to only 1 other person and then it stops because most of the people in green are immune either because they've had COVID-19 infection or because they've been vaccinated. We still recommend vaccine for people who have had COVID-19 because we know all of these vaccines have been designed deliberately to give you much higher levels of antibodies, as well as stimulate other features of your immune system like T cells and B cells. So we still recommend getting vaccinated if you've had COVID-19 infection previously, but it does figure into herd immunity. We're seeing it now, right? The number of cases, as well as number of hospitalizations and deaths, are on the downslope, but we're not quite where we want to be yet. You may have seen that AstraZeneca had a press release. They are applying for an emergency use authorization. I just want to share a little information about their vaccine. In terms of vaccine approach, it's similar to the Janssen vaccine. What they do is they take an adenovirus vector. They take a common cold virus, but this is a cold virus that affects chimpanzees and will not make humans sick. And it's also really unlikely that most of us have ever been exposed to this cold virus. The cold virus acts like a delivery truck carrying a special cargo. And that special cargo is spike protein gene. Both AstraZeneca and Janssen use DNA instead of RNA because it just makes the vaccine easier to handle. It doesn't need that super cold chain. For AstraZeneca, they tested it in 2 doses, 4 weeks apart. And in their press release, they talked about, AstraZeneca has already been approved in 50 countries worldwide, but the United States wants United States data. We want to make sure that we have monitored these studies and that they are up to the quality level that is expected in the United States. The US phase 3 trial, over 32,000 participants, they just reported 79% efficacy in preventing symptomatic COVID-19 disease and 100% efficacy in preventing severe disease and death. That was using some February data that you may have seen this little brouhaha about, well, wait a minute, that's not really the complete data. The additional data, including their March information, it's probably more like 70% efficacy, but that's still really high. Again, eyes on the prize. The reason you get vaccinated is not to prevent mild symptoms. The reason you get vaccinated is to prevent severe disease and death, and AstraZeneca certainly does that. You may have also read about some concerns in Europe and in the UK about blood clots, and they specifically were looking for this. They had an independent data safety monitoring board looking at the specifics around phase 3 trials. They found no serious safety concerns and nothing about blood clots, and specifically looking for some detailed medical symptoms like cerebral venous thrombosis. So that vaccine efficacy was consistent across race and age. Looks like we're going to have a 4th vaccine appear on the scene, but it's going to take a while. They still haven't even submitted their EUA, their emergency use authorization, to FDA. I would expect that very soon. The FDA will probably take more time than they did with the Pfizer and Moderna to review it because it's a little bit more complicated. This was studied in a bunch of different countries that had different results with the variants. So it might be that they need 3 weeks to review. We might not see this vaccine until the end of April or early May. So I'm going to finish there and see if there are any questions.
All right, Dr. Kelly, thank you so much. And yes, there are questions, as always. The first one's coming from Dr. Cox, and Dr. Cox is asking, will free clinics get the Johnson & Johnson vaccine? He goes on to say this would be most helpful for those who have travel and job challenges.
Right. So the Johnson & Johnson, or Janssen as I call it, vaccine, right now, because it's the one that does not need to be frozen. It's single dose, keep it in the refrigerator for months. So it's really ideal for certain settings. For example, vaccinating the homeless, vaccinating people who are staying in shelters, vaccinating people who are homebound and we don't need to reschedule a second appointment for them. But it's also ideal for rural areas or for people doing mass vaccination clinics where they don't want to have to worry about how we're going to reschedule on these people for their second dose, for the federally qualified health centers, for the small independent pharmacies. So increasingly, as we get more and more of the Janssen vaccine, that's where it will go. And we should get increasing doses of it. Merck, I think we talked about this previously, that Merck, Pharmaceuticals is also going to be manufacturing the Janssen vaccine. So we should have a great increase in the number of doses during April and in May of the Janssen vaccine.
Thank you for that. Another question, have school employees been prioritized?
Yes and no. So DHEC does not recommend prioritizing any individual group entity. So we're not specifically prioritizing school teachers. Why? because the issue from DHEC's public health point of view has to do with mortality. The people that we want to make sure we get vaccinated as soon as possible are the people at highest risk of severe disease. That doesn't include school teachers and staff as a group, as a whole. Some of them are young and healthy. They are in phase 1B because we want to make sure that they get vaccinated because they are frontline workers. They're at increased risk. Some areas of the state have made a decision that they want to vaccinate at a higher priority school teachers. Some areas of the state have also made a decision that they want to prioritize more the age 55 and above. That's okay. When we send vaccine allocations out to vaccine providers, those individual providers may make certain decisions about prioritizing vaccine clinics. So they may, for example, collaborate with a school district to make sure teachers and staff have their own separate vaccination clinic.
All right, thank you for that. Lily is asking, Safe Harbor clients has clients without emails and cannot register on any websites. How can they get their elderly appointments?
Right, and so there are a couple of answers to trying to work with that. We are trying to also work with through that CVAS system I showed. Again, this means that you're trying to go online to make an appointment, and we know that that's not adequate. That we also need ways where people can make appointments via telephone, and we're working with some partners. For example, AARP is trying to set up a system where people can call a toll-free number through AARP, and there'll be somebody on that phone line who can make you that appointment. And also trying to increase the number of mass vaccination walk-in registration clinics where people don't have to go online first. What they do is they just show up, and somebody with a piece of paper will take down their information.
Thank you. Rachel is asking, are hospitality workers part of this phase of the vaccine deployment?
Yeah, this is a change. So originally we had been considering that phase 1B would be people who were frontline essential workers. And that harkens back to, how do you define essential? And we're not talking about essential as in services during a hurricane, for example, where hospitality honestly would not be an essential service. We're talking, water supply, electricity, food chain, things like hospitality would not have fallen in that. But we have decided the best way to do the phase 1B rollout is to not try and define essential. Rather, it's not the job you do, it's the risk your job causes you. So if you are in phase 1B, if you are a frontline worker, meaning that you are working with people closer than 6 feet for more than 15 minutes at a time, and you can't really distance. If you're able to keep that distance and be working, then you are not frontline. But if you are unable, you are. So hospitality workers who are within 6 feet for more than 15 minutes with customers, patrons, yes, they are in phase 1B.
All right, Dr. Kelly, next question is coming from Benjamin. Benjamin is asking, how much have testing levels decreased since the vaccination numbers are going up?
Yeah, testing levels have decreased, and some of that is appropriate. That some of the places where we had been recommending get routine testing, even if you're feeling fine, among people who are fully vaccinated, we're not recommending getting routine testing in most circumstances. I mean, nursing homes are a different situation, but in most circumstances, if you're fully vaccinated and you are exposed to someone, but you have no symptoms, we're not necessarily recommending that you get tested. So definitely some testing has dropped off because of that. I'm also a little bit concerned that some testing may have dropped off just because people are feeling, elated that things are looking better. And so they don't need to be worried about getting tested. So, we still have testing recommendations. If you've been exposed, or if you're not certain that you have been exposed, like you don't know a person who has SARS-CoV-2, but you were in a venue, you were at an indoor event where you were exposed to a lot of people, you might want to consider getting tested, even if you're asymptomatic, but certainly if you have symptoms. So testing has dropped off. Some of that is for a good reason. Some of it, I'm worried people are a little too complacent. So we are still encouraging testing, especially if you have symptoms and especially if you think you may have been exposed.
All right, thank you. And our last question this morning is coming from Mark, and Mark is asking how much immunity is built up after the first shot.
Depends a little bit upon the vaccine, and there are some different numbers. At first, it was said for Pfizer and Moderna, it was said it's only about 50%. Later studies have shown closer to 70%. But what does that percent mean? I'm talking about 70% based on neutralizing antibody levels, but that doesn't tell you how long those antibodies last. And antibodies aren't the whole deal. Your immune system, I mentioned, you also make things called memory B cells and natural killer T cells. What's not known is after one shot, how long does that immunity last? You really need the second shot to, remind all those immune system. You need that booster to remind the rest of the immune system what they're reacting to. So you do get some coverage, maybe as much as 70% after the single dose. However, we don't know how long it's lasting. So it's still important to get that second dose of vaccine.
Dr. Kelly, thank you again. Another very thorough presentation and great explanations and answers to the questions. And for our listeners, she's always so kind to allow us to share her slides with you, and we'll be glad to do that again today. So that was Dr. Jane Kelly with DHEC, and thank you, Dr. Kelly. We look forward to our next time together.
Sure. Thank you very much for inviting me.
All right. Thank you. And lastly, simply want to say stay safe, be kind, and wear your mask. And don't forget to get your vaccine. Have a great day, everyone. Bye-bye.